We're hearing a lot of things on the news right now about potential cures and medicines that may be coming out and immunoglobulins, but it's important to keep our eye on the ball here. I mean, this takes me back to my military days when a bomb would go off in Iraq and there'd be hundreds and hundreds of patients on the ground. At that time, you have to prioritize, or what we call in medicine triage, and do the appropriate things. And at that time, you're not waiting for aid in the form of, for us, immunoglobulins right now or medicines or things like that. The power is with us. The fight has come to us, and we need to follow the proper strategies when we are sick, and then also if we're not sick, how to prevent it. And that's what's going to help us fight this enemy.
We talk about this arc, Doctor, about slowing in the number of new cases. We've seen some, and I put that in quotations here, that they're slowing in places like Italy. They're slowing across Europe, but they're still increasing. I mean, these are still staggering numbers, to put it mildly. And we still expect, at a minimum, maybe over 100,000 deaths in this country. Could go as high as 230, 240,000. Maybe even significantly higher than that if these mitigating measures we're taking are not honored or adhered to. Do you look at that trajectory and say, all right, I kind of agree with what I'm hearing. I kind of agree with those models that show that's where we're going?
That's a great question. I mean, in Texas, where I'm practicing right now, we always have like the first 100-degree day. And what happens on that first 100-degree day is that it's unpredictable. We don't know what's coming in. People have trauma, people have this, people have that. So there's an element of this that's also unpredictable. I've seen numbers like a couple 100,000. I've seen numbers as high as 1.7 million deaths. So, but what I do know is predictable is that the power is with us to take certain preventative measures and to do certain things when we're sick. And what I suspect will happen is we're probably following the curve of Italy, maybe by 4-6 weeks. And we're in the acceleration phase right now in the United States. So that means the cases are going to ramp up. We don't know how long this slope is going to be, but the power is with us. And what we have to do is be very rigid in the steps that we follow. And, from the walls of the emergency room, what I often find as a phenomenon is that people who have certain conditions or health conditions, they don't really worry about it until they have it. For example, you don't care about gout until you have gout or a loved one has gout. So similarly, I think what's happening in the United States is a lot of people are not seeing it in person. Maybe they're seeing it on the news, and maybe it hasn't quite registered. So from the emergency room where, we're trying to help people breathe and save them, I would like to portray that, this is important. Please follow the rules, and we can mitigate those numbers a lot.
Well, you're a big reason why we are, and I appreciate all your effort. I know you've had very little sleep, Doctor. So thank you for being on the front lines and having such a great attitude about it. We owe a lot to you.
Well, thank you to respiratory therapists, doctors, nurses, everyone throughout. This is a team effort.
Yeah, incredible team at that. Thank you, Doctor. All right,